We shall be talking about tumor necrosis factor alpha inhibitor drugs in this lecture. The drugs we shall be studying are etanercept, infliximab, adalimumab, certolizumab, golimumab. So before we begin, let's understand exactly what tumor necrosis factor alpha is and why it's important. Well, the summary of it is basically it's involved in inflammation. However, tumor necrosis factor alpha is actually a cytokine central to many aspects of inflammatory response. Macrophages, mast cells, and activated T helper cells secrete tumor necrosis factor alpha. Tumor necrosis factor alpha stimulates macrophages to produce cytotoxic metabolites, thereby increasing phagocytic killing activity. So here, you can see a stimulus-activated monocyte or macrophage, and then it produces tumor necrosis factor alpha. However, it has a lot of effects on different parts of the body. First of all, it has effects on osteoclasts in the bone, which lead to aberrant activation of osteoclast formation. Well, you remember, osteoclast activity causes breakdown of bone. If this happens in the joint, it's going to cause you to have increased bone resorption, joint space narrowing, causing a lot of inflammation. Also, it affects adipocytes, which interfere with their metabolism, also affects monocytes, which increases their differentiation, and also causes endothelial cells to increase cell infiltration and increase angiogenesis, which is formation of new blood vessels. It also has effects on myocytes, which is in the cardiac muscles, which leads to myocardial dysfunction, cardiac myocyte death. It also has effects on glial cells, which causes modification of synaptic transmission, and also effects on fibroblasts, which leads to apoptosis. Now, when it binds to hepatocytes, it leads to increased acute phase response, which leads to increased inflammation. That causes increased formation of C-reactive protein, which you know is a marker of inflammation in the body. This can be detected in the bloodstream in the serum, where you can test for a patient that has increased inflammation from any inflammatory conditions, and you check for CRP levels, and that's because of the effects of this tumor necrosis factor alpha. It also binds to B cells, which leads to formation of antibodies, and T cells, which cause more T cell proliferation, which can eventually lead to inflammation. So as you can see here, it has a lot of effects, but you also need to understand that it causes cachexia in malignancy. So patients often complain of losing weight, right? A patient that has a small cell carcinoma of the lung or has a renal cell carcinoma often complains of weight loss. Well, the reason why they're losing weight is because they have this tumor necrosis factor, right? Causing necrosis, which is death. And because it's involved in that, in cancer cells, this patient eventually develop cachexia and they start losing weight. Remember, in tuberculosis, the ability of the granuloma to stay stable is because of the effect of tumor necrosis factor alpha. So that's how macrophages are able to entrap the Mycobacterium tuberculosis organism and form a granuloma inside the lung. So it's very, very important. Now, in sepsis, interleukin-1, interleukin-6, and tumor necrosis factor alpha also can mediate sepsis. Now that we've seen the effects of tumor necrosis factor alpha, now we can further understand how drugs such as etanercept work. Well, what is etanercept? Well, etanercept is produced by recombinant DNA. Now let's study etanercept in a little more detail. Here, first you have to realize on the cell membrane, we have the tumor necrosis factor receptor, which is the P55 kilodalton right here. Now that has to bind to tumor necrosis factor alpha. Now also we have the second receptor for tumor necrosis factor alpha, which is the tumor necrosis factor receptor 2, which is a P75 because it's a 75 kilodalton protein. Now, when tumor necrosis factor alpha actually binds to its receptors, it has pro-inflammatory cytokines and basically initiates the pathologic causes that we had talked about earlier, which like increased inflammation, activation of proliferation of B cells or T cells, B cells making antibodies, just like we talked about earlier, or even effects on the liver, for example, increased formation of C-reactive protein, which is a marker of inflammation. So now, etanercept, on the other hand, was discovered and it was created by actually having identical receptors of the domain of the human P75 TNF receptor. So what they did is they took this TNF receptor itself, created an identical copy, and then combined it to the IgG G1 FC portion of the human antibody. See right there. So now we have like a partial antibody binding to this receptor, and that's what etanercept is. And you see, this is the FC region of the human IgG1 antibody. So using that, that's why it's produced by recombinant DNA. Now, the important thing is that now etanercept can actually bind to tumor necrosis factor alpha. That is how it works. That's its mechanism of action. See? So once it binds, well, tumor necrosis factor can no longer bind to its receptor on the cells, which means there's no more signal transduction. You can have that massive inflammatory response patients get, and there's no effects on osteoclastic activity or chondrocytes. There's no inflammation in the joints, and patients actually feel better. So what do we use etanercept for? Well, it's used to treat patients that have inflammatory conditions such as rheumatoid arthritis, psoriasis, and ankylosing spondylitis, right? Remember, these are all inflammatory conditions. Patients that have rheumatoid arthritis or will have joint pain, right? Because they're constantly having massive inflammation. Also, patients that have ankylosing spondylitis are always having back pain, right? So in psoriasis, they usually develop a rash, but they can also develop a psoriatic arthritis, right? So you can see itis. Oh, it's all about inflammation about this condition. So how do you remember this for the board exam? Well, just spell out etanercept and look at the T and the capital N intercepts TNF. So etanercept, the TN, intercepts tumor necrosis factor alpha. Now let's take a look at monoclonal antibodies. Well, as you can look at the word, mono means one, clonal means basically a cloning single antibodies, right? So these are basically antibodies. So we've got infliximab, adalimumab, certolizumab, and golimumab. Well, their mechanism is actually pretty straightforward. Right? They are, whenever you see the word MAB, right? MAB basically stands for monoclonal antibody. So on the board exam, once you see MAB, you know we're talking about monoclonal antibody. So it's pretty straightforward. But what they do is they are anti-tumor necrosis factor alpha monoclonal antibodies. So here, side by side, you can see this is infliximab, right? It's a chimeric antibody, right? And it's a little bit different from etanercept, right? So if you look here, we have the heavy chain and the light chain of the human antibody, right? That's the constant regions of the human antibody, right? And they bind here, they will bind to tumor necrosis factor alpha and basically negate the effects on the cell membrane so they don't bind again to the tumor necrosis factor alpha receptors. Now, if you look at infliximab, adalimumab, and golimumab, they're all monoclonal antibody. However, certolizumab is a pegol, which is a pegylated FAB fragment. Okay, it still works by binding to tumor necrosis factor alpha. If you compare that to etanercept, which we talked about earlier, which is a soluble receptor, see, it has basically that tumor necrosis factor receptor here, which is used to form the first portion of it, and it's not combined with the FC fragment of the human IgG1 antibody segment. Okay, that's what makes it separated from all this monoclonal antibody. Now, it's used to treat the pair disease. That's what I call them. So pair, which is psoriasis, ankylosing spondylitis, inflammatory bowel disease such as Crohn's disease or ulcerative colitis or rheumatoid arthritis. These are all have the same pathology, right? It's all about inflammation. So if you can decrease inflammation in the patient's body, they have less pain and they feel better. This is why we treat patients with monoclonal antibodies. So on the board exam, remember PAIR. That's the mnemonic to be able to for diseases that we treat these monoclonal antibodies. So you're probably thinking to yourself, oh my goodness, how am I going to be able to remember all these monoclonal antibodies? Well, we've got a beautiful mnemonic for you here. So the way you remember is Adal got certified by inflicting pain on TNF. Wow, that is easy, right? So what you have to look at is ignore the last couple. Remember, it's basically MAB, right? They all have MAB in them, so it's very easy to remember that part. It's now try to keep track of which one of them when you've been tested on the Usmle or the Comlex of which I'm supposed to pick, right? so I can know which one is being used? Well, Adal is the name of the guy. In order for him to get certified, he's got to be able to win the championship, right? He's got to win the match. Well, the match is the battle between patients that have pain, right? All these patients have pain. Rheumatoid arthritis, complain of pain, right? Knee pain, joint pain, back pain, ankylosing spondylitis, right? Inflammatory bodies, they have abdominal pain, right? They have blood in their stool, depending if they have ulcerative colitis, right? Because they have an ulceration in their bowel leads to severe amount of pain. Now, so Adal is the main guy. He's our guy who's got to, in order for him to get certified, he's got to inflict pain on TNF. Once we inflict pain on TNF, we give him a chemical knockout, we'll punch him in the face, and now the patient feels better, right? So now that's how we get certified. So adalimumab, golimumab, certolizumab, and infliximab, right? That is how you remember this for the board exam, okay? So if you really enjoyed this lecture, we'd like you to click below on the icon to subscribe to our channel. And also, we'd like you to visit smashusmle.com to be able to watch over 300 hours of USMLE and Comlex review lecture videos such as this to be able to do well on your board exam. Thank you very much for watching. Have a great day. Bye-bye. Hey, thank you so much for watching the video. I hope you learned a lot. Are you studying for the USMLE Step 1 or Step 2? Are you studying for the NCLEX or you're currently in nursing school as a nursing student? Are you a PA student currently in school or studying for your PANCE exam? Or are you a nurse practitioner student or trying to take your NP board exam? Listen, I've got super awesome content for you. If you truly love this video and it simplified your learning process, I want you to check out my website below. I've listed all the list of exams, whether you're studying for any of this board exam, and all I want you to do is click on the link right now below so that you can take you directly to my website. For USMLE, just go to smashusmle.com. For NCLEX, go to crushnclex.com. And if you're studying for the PANCE exam, the nurse practitioner exam, or you're studying for your internal medicine board exam, just click below and it'll take you directly to ftplectures.com. Listen, I can't wait to help you. If you need to get in touch with me, just get to my website, you're able to reach me directly, and we can work together one-on-one. Listen, you're super awesome, and my goal here is to help your dream come true. If you want to be a doctor, want to be a nurse practitioner, a registered nurse, or physician assistant, I'm here to help you get to that next level. With your medical knowledge, let's save the world together. I love you guys. You guys are super awesome, and do not forget to click on the link below to be able to get to my website. Also, don't forget to subscribe to my channel. You guys have a great day. Let's go.